Well, in the hospital that I work in, we have nursing ratios, and I want to help everybody else get them. We have them through our union contract. But I see nurses all over the country that are telling us about having to be assigned 9 or 10 patients or 5 patients in an ICU, and they're basically deciding who lives or dies. And I think that nurses are in this profession because they want to help and heal, and they are not being able to do it, and they're leaving. And who is going to come after me to take care of patients?
So for me, mandated ratios means safety for not only the patients, but for the nurses. Every day we go to work and we go for the right reason. We want to take care of people.
Yes.
And so many times we're stretched way too thin that we can't, not only can we not do what is asked of us, but we can't give quality, safe care to our patients.
Exactly.
So not only does that put them at risk, but it puts us at risk.
Why are safe patient ratios important to you?
Well, it affects me every day. It affects my stress. It affects 14 hours of each of my day. It affects my patients when they can't get their pain medicine as quick as they want.
Exactly.
When I can't catch a patient going downhill as quick as I should because I have too many patients. So it should be important to everybody.
Why are safe nurse-to-patient ratios important to you and important to nurses everywhere?
Because the ultimate outcome is to benefit the patient.
Exactly.
You know, you give more time to the patient. A lot of times too, you know, it's not so much getting them to a physical state of well-being, but also holistically, emotionally too.
Having been a nurse for over 35 years, I know what I am capable of. And I have to tell you, I was very good at my job.
Good for you.
And I knew what I was capable of. And there was no way that I could do what I should have been doing, given the number of patients I had
Yes.
and the number of staff I had. And whenever anybody from administration tried to tell me, well, other people can do better, I said, don't even tell me that, because I know it cannot be done.
Well, even though I'm currently retired, I chose to retire because the workload of nurses put me in an unsafe situation
Exactly.
constantly, day after day, where I didn't feel safe in my practice.
Nurse-patient ratio is so important because I have several friends that work in long-term care, and to have a nurse be 1 to 60 as a patient ratio is not giving the proper care that every patient deserves.
Because a nurse can only be one place at a time.
Yes.
And if you have 10 people who need you, you are not going to be able to take care of everybody. It's not rocket science, it's just arithmetic.
Did you hear that? It's just arithmetic. It's just arithmetic, and I love that.
Even though I'm no longer practicing, I'm on the other side. I'm the patient. I have a father who's 87 years old. I've got grandchildren. I have people in my family that I love. And I want somebody to be there to take care of them. And unless there are enough staff to take care, when you're in a hospital, you need a nurse.
Yes, you do.
You're not there because you need surgery or you need physical therapy. All that stuff can be out. If you're in a hospital, it's because you need to be monitored by a nurse.
Yes.
And that cannot be done without nurses.
Because we can make changes now,
Yes.
it's important in my retirement that I choose to stay and work this fight that we've been working towards for 20 years.
Can I just shout out to the nurses out there? Just understand what's happening right now. She's been a nurse. She's done. She's retired. It's over, right? And she's still fighting for your rights. She's fighting for better patients' rights.
We can't take care of our patients the way that we are called to do if we have too many patients. I can't go home thinking of how many tasks I left incomplete. I need to be able to go home thinking I cared for my patients today. I made a difference in their lives. I made a difference in their health.
So what safe nurse to patient ratio means to me is the amount of patients per nurse should be appropriate so that the nurse can provide quality, effective care to the patient.
Yes.
And that is so important because patient safety is extremely important. And also nurse retention is really important, allowing nurses to stay at the bedside for a substantial amount of time and not going crazy and not getting burnout, and being able to do the things that they need during their shift, like use the bathroom, eat lunch during their 12
The
hours.
simple things.
Simple things,
The
but
simple
we often don't get to do them because we're one person taking care of 8 8 and 10 people sometimes.
And when we don't have enough time to listen to the patients, we cannot really manage their pain, their concerns, and anything that has to do with their overall health in general. So I think just to have enough staffing will allow us more time to be a lot more human.
Of course.
Because they're expecting us to be superheroes.
Exactly.
And we are, but...
We sure are. You can say that again. We are heroes.
We are, but it's definitely, it would help a lot more if we were able to get more hands on staff to make sure that it's not monetary, but more humane.
In every shift, if I have the ratio that is
Considered safe.
considered safe, I have the time to look back in the patient's history, find things that I wouldn't have had time to find otherwise, to have more time to talk to the practitioners about the plan of care and advocate for my patient and talk to my patient, most importantly, find out what's important to them, find out their needs, and communicate that to the team. And if you have too many patients, you simply do not have the time to do that for every person.
Hi, it's important because I need time to get to know my patients. I just don't want to walk in the room, look at a diagnosis, because sometimes there's other things that's going on. And once we talk to the patients and get to know their history and their families, we can make better decisions on their health care. So it's very important that we have enough time to spend with each family, because it could be you.
Nursing affects everybody's lives because we're taking care of everybody's loved ones on a daily basis.
And I love it. Straightforward, to the point, and it's true. The end of the day is, I hate to say it, but we're all going to get older. We're all going to have some kind of illness or ailment happen to us.
You can be young and have a medical emergency.
Exactly. And when that happens, knock on wood, hopefully it's not anytime soon, but when it does happen, we need nurses that can give care to us, and quality care at that.
Right now I'm at a facility where in the ICU we're constantly getting 3 patients, and it's not only an issue of unsafe as far as harm coming to patients, but I cannot deliver the quality of care that I need to and I'm used to giving.
Yes.
Patients are not getting better. Not only are there adverse effects, but they're not healing and not getting better as fast as they could.
I hear that. And like, that's the thing. Like, what you guys need to understand, and for the nurses watching, you get it. But for everyone else, you have to understand that we're doing this not to make our lives better, but to make it safer to do what we do, and to make the quality of care that we deliver to our patients, aka you, better.
We can't do the job that we're held responsible to do when we're not given safe patient ratios.
Yes.
We just heard one of our speakers talk about an incident at her hospital where a patient died because their Levophed drip went dry.
And that's serious stuff.
Yeah, while they were attending to an emergency situation, and I can't imagine having that on my conscience.
It's the scariest thing ever. It really is.
You know, I actually had a family member who was on our unit, and it meant so much to me to know the nurses and know how passionate they are and how much they care, and they truly love the patients they're taking care of. But then I was really worried at the same time because I know how much of a struggle it is just working and wanting to be there for our patients, and going home sometimes and feeling like I'm a bad nurse because I couldn't provide the care I wanted to, because I simply couldn't get to everything because there was just so much.
The struggle is real. The struggle is real.
Both the nurses and the patients can sense it when you're overworked and you're stressed and don't have the time to give them 100% of yourself. So I think if we want our patients to be treated how we would want our family members to be treated, then it's just not fair to them to have us be juggling.
I actually left different kinds of practice environments just because of the safety issues or feeling overwhelmed or burnt out. And I continued to move on. Some of it that was ambition, some of it was that, but some of it was also, working in an area where you feel like you can't do the job that you were trained to do. Yes. So I thought, well, I'll just get a different specialty and I'll work in a different place. And it kept happening in every specialty and every place that I worked. And then I thought, well, maybe I need to become more educated and have a different skill set, and that would help. And that didn't really make that much of a difference. With each level of education and each certification and each specialty that I earned, it didn't change the fact that my employer could give me an assignment that was unsafe or put me in a predicament where I was going to jeopardize my license.
Safe patient ratios are very important to me because I became a nurse to care for people.
Yes.
And when I'm getting tripled in the ICU and I see nurses getting dumped on the floors with 8 or 9 patients, people are not getting cared for. They're getting handed pills, and there's failure to save, there's code blues, there's code whites, that stuff shouldn't be happening as frequently as it is.
I believe in safe nursing, nurse to patient ratio, because it helps me give quality care.
Exactly. Simple, straight to the point. And that's what we want, you guys.
And safe patient limits have better outcomes for all the patients.
All day, every day. Thank you.
The whole backbone of society rests on our health.
You better believe it. I mean, and that's through and through, like to the core of who we are as people. More than anything else, people want a long, healthy life. And if you give the nurses, who are doing the majority of the patient care, the tools that they need to do the care that they need to do, not only are we happier, but the country, the community as a whole is better.
Right.
We're not asking for this to make our jobs easier. We're asking this to make our jobs safer. We're asking for this so there's a healthier world, if we're going to just be straight honest with one another here. We need this. Not just for nurses, but for the people nurses take care of. And fun fact, that's everybody. We all need this.